to our Love and Learn educational series for 2026. And we are live on Instagram today to answer all your questions about GLP. And so let's get this party started. We have here today with me the fabulous nurse practitioner, Heather Kinder. She performs our medical care and oversees prescription management at Optimate Health and Wellness. And of course, we are really big on education. It's been the cornerstone of the practice going on 19 years now. All right, so we've added questions here. And of course, if you have questions, please feel free to put them in the comment section. We will try to address all the questions that you have. All right, as GLP becomes more popular, why don't we start with a basic question? What is GLP-1?
Okay, well, GLP-1 is a peptide receptor agonist, and so it will stimulate your GLP to work, which inhibits appetite, increases insulin release from the pancreas, and prohibits glucose release from the liver. So a lot of effects from GLPs, as we know, it's being used more or researched in more things than just diabetes and weight loss. Now it's benefiting heart disease, and possibly they're researching it for dementia and a lot of other benefits. But for today, we're going to limit our conversation to weight loss primarily.
So it was originally used for diabetes, and then it's become more of a popular weight loss medication.
Yes, originally it was released as Ozempic for weight loss. For diabetes, excuse me. And so then they noticed that people were losing weight, and it seemed like it was likely related to the decrease in appetite. But now we know there's so many effects of GLP-1s on the body, and weight loss is one of the effects.
Yeah, awesome. Okay. So, first question, why is practitioner involvement so important?
Yes. So, as many of you might know, GLP-1s can be accessed now online easily. But I do believe that you would have a much better experience if you had if you decided to use GLP-1s with a practitioner to help you with counseling as far as avoiding side effects, optimizing your health while you're losing weight, because you could lose weight and be less healthy in the end than you were when you started if certain situations arise. Also, you want to be fully educated and aware of all the risks. Manage side effects well with a practitioner. So I think that it's important. And your dosing can be managed well with monthly updates with a practitioner, because you don't have to keep going up on the dose. Many people do really well on low doses without needing the higher doses.
And so this is called microdosing, correct?
Well, microdosing is a little bit different. It might not result in significant weight loss, but does benefit the body by reducing inflammation, oftentimes reducing glucose and insulin levels. So often microdosing could be used to maintain weight loss, and it's not going to give you a significant amount of weight loss. But staying on the low prescribed dosing often can give enough benefit for weight loss.
Excellent. All right. On to our next question. What are the must-dos while you're on a GLP-1?
Okay. Well, if you want to use GLP-1s for your health benefit, then you would want to make sure that you eat vegetables, lots of vegetables, to clean the insides of your intestines, I say. Mm-hmm. Maintain bowel movement regularity, because that's one of the risks is constipation, which is not a benefit for you. And do strength training, because your body can lose muscle faster than it can lose fat. And so we don't want to do that, because in the end, then you'll have worse metabolism and worse health if we have muscle loss over time.
Great. Yeah, again, more reason to have good support.
Yes.
So that you can oversee that. Okay, let's try this one first. Am I on GLP forever once I get started?
Yes, that's a common question, and it's a tricky one. So diabetics stay on GLP-1s for the long term, for the most part. It manages their diabetes really well. For weight loss, I mean, you certainly can come off of it. A lot of people do come off of them because of financial constraints, or they just don't want to be on medicine forever. But it is very common to regain the weight. So another reason to have great practitioner support is to support you as you're trying to maintain your weight loss. So you do not have to be on them forever. It's definitely not a lifelong commitment. But you have to take the time while you're on the GLP-1 to change your lifestyle. If we don't have significant changes in our diet and exercise patterns, then maintaining the weight loss is not very realistic.
Excellent, yeah, absolutely, right? The things you're going to learn, and so the combination of learning to how to make those lifestyle changes with the great support to oversee your health and labs sounds like a great plan.
Yes.
Okay, this leads into this one. How would you recommend someone maintain their weight loss after they are off the GLP?
Yes, so, I mean, for decades, it's been proven that resistance training and exercise is a very important piece of weight loss maintenance. So you have to establish a great exercise routine while you're on the medication and be able to continue it after. For women who are probably in their 40s and over, strength training is a significant piece of that, maintaining metabolism and weight loss. And then just continuing on your healthy diet, it'll be a lot harder off the GLP because those cravings will come back, and the food noise, people call it, comes back because the GLP-1 does stimulate your leptin hormone in your brain, which causes satisfaction and removes cravings. So when that benefit is gone, it is harder to maintain your diet, but you want to remember, how you felt when you were losing the weight, when you weren't eating sugar, when you weren't giving into cravings, when you were eating less food. It is also shown in research several times, repeatedly, that lower calorie diets do correlate with longevity. So we don't need to eat a lot of food all the time.
And that longevity term is the hot word right now in health and wellness. Okay, our next question. What do I need to know about where my GLP is sourced?
Okay, so one of the things that you do want to think about is if you're getting your GLP-1 injectables from online or mail shipment, you want to know where it's coming from and what practices that pharmacy is using to produce it. We're assuming here that we're not getting it from the brand. If you're able to get it branded, great. That would be Ozempic, Mounjaro, Zepbound, and Wegovy. Or Ribelsis is a pill, semaglutide pill. If you're not getting them branded, then it's going to be compounded by a compounding pharmacy, but you want to know about the pharmacy. Like, are they sending it out for third-party testing, which would be for purity and potency? Is it a reliable place? Have they been making it for a long time? Have they shipped out large volumes of their medications so we know that it's being used in large quantities of people and it's been safe? So those are the questions that you want to ask. You want to do some research on the pharmacy where you're getting it. We here at Optum8 only use compounding pharmacies that we have seen their product used in thousands of people. And so it's been safe, it's been used safely, and it is third-party tested.
It's such a great kind of point of expertise we really rely on here, not just in GLP, but in supplements as well. Yes. I think most people use the price point and they bargain shop for supplements, now with something like this, and really this is why practitioner involvement can be so important to your success, because if you're spending money that is on a cheaper product, you may be saving money in the front end, but are you spending more in the long end because you might be on it longer and or not see the results that you're expecting? And this is in anything from a vitamin D to an omega to your prescriptions. So awesome. All right, let's go on to our next question. Will I poop on GLP? That's a big question.
I
right?
like talking about bowel movements. Yes, constipation is a very common side effect, and the reason is because the medication slows down the emptying of your stomach and slows transit of food through your gut. So constipation is very common, and I would say one of the signs that the medicine's working. So we need to maintain our vegetable intake, make sure we're hydrating, normally 60 to 80 ounces of water a day, and pay attention. If you're not having daily bowel movements, then we want to add in a magnesium product. The one we use here is called Oxy powder. It's very safe and actually good for you instead of using a laxative or, Miralax or Metamucil, which is okay as well. But the magnesium is beneficial for your body. So you do want to pay attention to your bowel movements.
Yeah, the support again, and the nutrition support sometimes can come in the form of a nutritional supplement. So any concerns you have, again, it's really good to have a good plan, not just a good GLP.
And one more thing I forgot is one of the complications of using GLP-1s is intestinal obstruction, just because of the reality that I shared about how it slows the transit of food through your gut. So nobody wants complications, so we can avoid that for the most part by paying attention. Make sure you have daily bowel movements with all the strategies we just shared.
Would it be beneficial to think a little bit more about the way food breaks down in general if it's going to sit in your gut for longer? Is that fair to consider?
Yes.
I start talking about that with people.
Yes.
The way we think about how vegetables will compost, but meat kind of rots.
Yeah.
So
okay.
Having a good amount of vegetables isn't just the fiber, the insoluble and soluble fiber that will help you poop, but those foods will have higher nutrient content and maybe avoid some of those concerns.
Yes, because red meat is already hard to digest. So if you eat large amounts of red meat on GLP-1s, that's not beneficial for your body because they will stay in there a long time. Mm-hmm. And as Laura said, the vegetables, one of the problems on GLP-1s is lack of nutrients. And so we definitely need to make sure we're getting enough nutrients to maintain our hair, to maintain our muscles and our immune system. So vegetables is the best way to do that.
Yeah. The more color, the more nutrient density something has. So also too, if your appetite is really low, blueberries is going to have more phytonutrients than a banana, right? So just think about color. Lead your plate with color. That's going to give you those nutrient density. Okay, we ready to kind of shift? This is a different, is GLP something that we already make inside our body?
Oh yeah. So yes, we already have GLP in our body, and it's supposed to be stimulated, released when to tell us we've had enough food to eat. So it is obviously common for us to have not enough, which I think is related to the microbiome in your gut and whatever kind of gut disruption you have, and maybe you're not producing enough GLP-1. There are ways to stimulate your own GLP-1 production, but yes, we do have that already in our body, and the medication is stimulating the release of that.
All right. Let's see. Do we have any questions that are happening live that we can? Okay. All right. We'll keep going with our questions from here. If I'm scared about starting GLP, what should I do?
Well, talk to a practitioner who is knowledgeable. A lot of people are prescribing it now because it's the popular thing, but not everyone has deep knowledge of the medication, how it will affect your body, how to educate you to protect yourself from complications or side effects. So if you're scared, I would say talk to somebody that knows. I would also say, one of the things that might be a good idea is to do blood work first, see what other factors we could do first naturally as far as optimizing vitamins and nutrients and blood sugar, insulin levels, things like that. And then if you still need to get on a GLP-1 because you have a goal weight in mind, then we could discuss that. But you could start with natural lifestyle changes that are based on your individual blood work results.
Yeah, if you're deficient in something going into it, you'd want to address that alongside that. Yeah.
Mm-hmm.
And we live in an age where information is really at our fingertips, but good support care is really going to include the relationship you have with your practitioner so that your numbers can be put into context with your health. The way we eat is really a relationship we have with food, and this is kind of going to disrupt that relationship a little bit. So it is an opportunity to, again, get that baseline number that you need so you know where your pre-existing nutrient deficiencies are, where you're going to need support through the process, and how to have that whole prescription management supportive and done in the context of who you are in your relationship with food. So, all right, let's keep going. Is there anything we need to know about long-term safety of GLP-1?
Well, GLP-1s have been out for diabetics for a little over 10 years, so the long-term safety data we have is just based on that. So we don't have 20, 50 years yet of long-term safety data, but the 10 plus years on using it as a diabetic medication does seem relatively safe. I would not be prescribing it if I didn't feel like if it was safe. There are complications that are possible. I do everything I can to educate patients on the complications. Some things that you need to, it's not recommended if you or your family has a history of thyroid medullary cancer or multiple endocrine neoplasia 1 or 2, which is also called MENS 1 or 2. Those are rare cancers. They're rare, not common. But those are things that we do need to ask. If you've ever had a history of pancreatitis, that's another thing we need to be aware of and use caution with, and gallstones. It's possible GLP-1 injections can increase gallstone production, so we do need to discuss that as well if that's one of your past history. Safety, but yes, other than that, safety seems to be, pretty safe. We've already talked about sourcing. We want to make sure we're getting from a good source and just following practitioner advice on how to avoid complications.
Great. All right. Yeah. Is it safe? That kind of is the same question as long-term safety. This kind of ties in maybe similarly, and we've probably covered some of it, but what are the risks of GLP?
Yes. So I think we've covered several of them. Dehydration, lightheadedness, it can lower your blood pressure because of the weight loss. Also because, sometimes it impacts people so much that they aren't interested in food or even drinking water. So that's another reason why to have a good practitioner to take care of you and monitor you, because we want to know, if your appetite is so limited that you're not interested in eating at all or drinking water, that's not going to benefit you. Your blood pressure can drop, especially this has been documented in older people, which is not safe at all, of course, for them to have lower blood pressure or be lightheaded. So we want to be careful with that. If you're exercising and you're feeling those symptoms, that's not safe either. So we want to make sure your dosage is individualized for you and you're getting the benefit at the lowest dose. Not just automatically upping your dose every month, as is seems like the practice of most online prescribing forums. Okay, so what did you say, complications? So intestinal obstruction, so make sure that you're monitoring your bowel movements. Hair loss is a possibility. Often that's from nutrients. So we want to make sure you're eating a nutrient-dense diet. We have specific supplements here that we love that give you the nutrients you need. We talked about pancreatitis. If you ever get belly pain, those are signs that we're having complications. You want to stop your medicine, call your practitioner right away or go to the emergency room. If you have pancreatitis or gallstones,
Well, you mentioned hair loss, so I knew I saw this question in there. Will I lose my hair on GLP?
It's possible. It's possible. Maintain your nutrient intake or use some of the supplements that we recommend. But yeah, it is possible. But I do believe it's mostly related to nutrient intake.
All right. What are the benefits of GLP beyond weight loss?
Yes.
And diabetes, of course.
So most people say they just feel better when they're on GLP-1s. I don't think we can say precisely all of the reasons why people feel better, but I think a lot of it has to do with inflammation, slowing inflammation in your body, so you just feel better. Your brain should feel better, less. A lot of people say that without the food noise and the cravings, they just have capacity to think about other things. They're not feeling burdened and anxiety about just constantly thinking about food and what they want to eat, but what they shouldn't eat, and this just constant play in their head that is very hard for them to handle. So I think it's the thoughts in your mind and the inflammation that really helps people feel better.
Yeah, when you think about that, the majority of people eat a high inflammatory diet. If they're just reducing that caloric load, then the inflammation is going to come down. There's also a system called autophagy. If anyone's familiar with that, that's a little bit of the way we kind of clean up debris, cellular debris and other debris, as we push that out of our body. And this is why intermittent fasting, when done appropriately, again under the support of a practitioner, is doing some of that. So again, just really important to get your nutrients. Sometimes too, when you're focused on a high nutrient density, you're changing that biome in your body, and that gut-brain axis is going to change. And so if you're really making sure that the calories you do consume are going to help your overall body be well, then that's going to change that craving center of the brain, that dialogue that you're having with food, for a more successful departure off of GLP.
Yes.
All right, let's see what else we have. How is pricing of GLP varying so much?
Yeah, it's changing a lot because of the access. So you can, like we said, find GLP-1s now online easily and get them pretty easily and cheap. I think the difference in pricing is going to be the quality of pharmacy you get it from and whether there is practitioner involvement. So you could go online and get 3 to 6 months supply, only visit with a practitioner maybe virtually once in those 3 or 6 months, and that's what's going to reduce your price if you don't have to pay a practitioner regularly for the prescription. We believe that, as we've talked about for repeatedly here, there's a lot of benefit to having practitioner monitoring, prescribing the doses that are appropriate for you. Like, let's say in 1 month you lose 5 to 8 pounds, which is not unrealistic. You do not need to go up on your dose. But if you go online and get it, they're probably going to tell you start at the starting dose and then go to the next dose, then the next dose. Whereas that might not be necessary for you and would incur more side effects, more risks for complications and things like that. So having a practitioner follow-up monthly or every 6 weeks is more expensive, but I think the outcomes are going to be much better. Your experience is going to be much better. And you will have a quality product as far as we have all the information that we have. So that's what impacts pricing.
I think for anybody that's watching, if you're financially considerate, that's how I like to approach things. We even talk about this with supplements. You know, you want to look at the price in the context of what you're getting for that. If you're grabbing it based on the price of, again, I'll use supplements, that's my area. That magnesium we offer, it's 375 milligrams in a single capsule. Most magnesiums are going to come in at maybe half that price per bottle, but they're coming in at 100 milligrams per capsule. So there's something to be said when you start to do a little bit of that math. Again, are you going to be on GLP for the shortest period of time, or follow some non-customized recommendation that might put you, wind up spending more money in the long run because you're on it longer, or like Heather said, a dosage that might be actually not appropriate for you. So there's bigger questions to be had. If you're a knowledge seeker, if you like to know what's happening with your body, having the appropriate care and support, nutrition around that care, in the long run may save you a lot of time, money, effort, including your own suffering. So we're all about helping people find that quality care at the best price, but sometimes that is leading with something that is going to save you money in the long run and give you better support and care in the front end. So that's something to think about there. Okay, pills versus shots. This is a big question that we hear a little bit. Is probably growing.
Yeah, so just recently, Wegovy came out with a pill. There was already a pill called Rybelsus, which is also semaglutide, which Wegovy is semaglutide. And so the Rybelsus pill was approved for diabetes. The Wegovy pill is semaglutide, approved for weight loss. And so what is the difference? I mean, the pill is every day. It only has limited amount of doses. I think the Rybelsus has 3 doses. The Wegovy may have 4 doses. Some people do believe or do experience more nausea with the pills than with the shots. But other than that, you know, I think that if you can afford the pills, so Wegovy's advertising that you can get them as low as $149 a month. I think that is a coupon from the company that doesn't last forever. If you want to try it, I would believe it's safe, you know, if we went through all of the risks and contraindications for your prescription. But I do think it's, you know, you can't customize a pill as well as you could customize an injection, right? So they're like standard doses, of course, and so you would start at the starting dose. We would not go up unless we had to, just like with the injections. The injections are a little bit more flexible dosing because if we're getting it from compounding pharmacies, we can be more precise and personalized with it. So, I mean, I think it comes down to cost and your preference. If you want to do a daily pill as opposed to a weekly injection, then we can certainly do that and see how you respond.
And the injection is something you administer yourself at home. You can, or come in and have it.
Right.
But the prescription is picked up at the pharmacy.
Correct.
Okay.
Right.
Just clarifying that too, just in case someone. Okay, let's see. Am I going to be nauseous or sick on GLP?
Well, the answer is that everyone's different. Everyone responds differently. We've seen so many responses. So nausea, vomiting, diarrhea, constipation are the most common side effects of using GLP-1s. And the reason is because of the way it works, right? Remember we talked about it slows down the emptying of your stomach, slows the transit of food through your gut. So one of the main reasons you get sick is because the food is sitting here in your stomach for a prolonged period of time. I educate my patients on how to avoid side effects because there's a lot of things you can do to reduce your risk. Eat healthy food. Like if you're eating whole, clean foods, it's less likely to make you sick. The things that I see that make people the most sick is high dairy intake, high sugar intake, fried foods, and high volume of red meat. Like we talked about, it sits there a long period of time.
Stuff that you just wouldn't want sitting in your gut.
Sitting there.
Yeah.
So it can make people feel pretty bad. Like when the state fair was around, there was a lot of bad effects. People going to the state fair if they were on GLP-1s. That was interesting stories. So yes, I have a lot of tips and tricks that can help people avoid the nausea. Some people just have nausea. Obviously, we can use Zofran if we need to. That's a prescription. I prefer not to use more prescriptions, but if we need it, we will use it. But there's a lot of things you can do to reduce your risk of having nausea.
And there's some supplements too that we can add. Also to making sure that someone's looking at your food diary to look at what nutrients, not just macros, you might be missing, but like some of your B vitamins might be missing, and kind of go through that supportive process. If you think about food that you can leave on the counter for an extended period of time, that might help too. Don't eat that.
You don't want that sitting in.
It's sitting in your gut, yeah. Okay, we've got one more question here. Is GLP a peptide? We see that word peptide. That is the hot word right now. Longevity and peptides are the hot word. So just some clarification. I think I definitely see it on Instagram advertised as a peptide. So here with the clarity.
Yes. So yes, GLP-1s are a peptide. We have them naturally in our bodies. The injections are stimulating the release of them. So they will, for the purpose of reducing appetite and increasing satisfaction.
All right. So as GLPs become more popular and more of your friends and family are asking questions or starting this, again, we've got your education and support here at Optimate Health and Wellness. And so we hope that you've enjoyed today, and we look forward to some more knowledge and support for you in the future.